Now we move to Leaders' Questions under Standing Order 36. We welcome Minister Simon Harris to take the questions. We start with Deputy Pearse Doherty, please.
Mike, Concordian, before I begin, I want to welcome the news of the ruling in the High Court in Belfast this morning that the British Government's Legacy Act is in breach of the European Convention on Human Rights, and I think it would be opportune to get an update on the interstate case early next week. Concordian, 2017 in Yevile Sishartia Cogan Realtas Agus and Tara Simon Harris Galtness na Mewain Januig Fanart Aberage Scoliosis or Finis Mona Keravi. Ag Brishu and Galtness and on the Pueshishan, Dorini Miguel Cantarhain, Casla Kylian Stewart, Agus Galordini Agus and Let and Yuhunta the Galord your Pueshi, Eg Fanart Niwain Keravi, Ag Kojaku Bianta or Fohonia and Opera Shaw. Minister, last week children and families came to the Dáil, like Kylie Ann Stewart and her parents. They travelled from across the state to have their voices heard. Now, Kylie Ann from Kilmacrenan in Donegal in my own county, she's 10 years old. She's a beautiful, young and brave girl. I had the opportunity to speak to her outside the gates here of Leinster House. But she, Minister, has been failed by your government, failed by the state, failed by the commitment that you gave her and the family 7 years ago. Kylie Ann has been waiting 5 years for critical scoliosis surgery. She and her parents were first told that she needed scoliosis surgery when she was 4 years old, yet she continues to wait. Her condition is acute, her pain is great, her parents, they're heartbroken. Right now, Kylie Ann's back is curved at 138 degrees. Her parents have been told that if her spine curves by a further 10 degrees, they will be unable to operate on her. Kylie Ann has had to be especially careful with the skin that covers the bones that protrude from her back. The risk is that the skin could break down, increasing the chance of infection. Now, I say all of this, Minister, because when we discuss numbers later on and all of this, this is the reality. This is the reality that Kylie Ann and her parents have to manage every single day, and many other Kylie Anns out there. We can't contemplate in this house what it must be like to endure that as a child, as a 10-year-old, to endure that as a parent as you watch on and know month passes, year passes, and still no sign of an operation. Knowing that there's a clock that's ticking, knowing that if the curvature gets worse, that the operation will not happen at all. And this is the life, Minister, for 288 children who languish on waiting lists for critical scoliosis surgery across our state. Last week, I had the opportunity to chat to many of them. They came here to the Dáil to make their voices heard and to say enough is enough. 7 years ago, Minister, you yourself gave a commitment as Minister for Health. You said that no child by the end of 2017 would be waiting longer than 4 months for scoliosis-related surgery. A promise you made, a promise you broke, made to Kylie Ann and so many other children that was broke year after year. There are currently over 70 children waiting for more than 4 months for this surgery, with many, such as Kylie Ann, who are waiting for years. Kylie Ann's waiting over half her life for this operation. 2 years ago, your successor, Minister Stephen Donnelly, made the same commitment. He announced €19 million funding for scoliosis-related surgery. Last week, he told the Dáil that he doesn't know if all of this money was even spent for this purpose. And at the same time, the government is asking parents and advocates to trust the system. After all of the years of broken promise, how could these children and the parents have any faith in the system, I ask you? There are things that can be done for the 288 children who are waiting for scoliosis-related surgery. Those who are well enough to travel could have accessed treatment abroad with a specific tailor programme. That was ended before the pandemic in 2019, and waiting lists started to rise again. And it beggars belief that the treatment abroad scheme was stopped while children are waiting more than 4 months for their operations. For those who cannot travel, we need to build domestic capacity. The government needs to identify a surgeon who can perform this work, even if it means an international search or bespoke arrangement. And the government must establish a truly independent task force that gets to grips with this scandal. So can I ask you, what's your plan for Kylie Ann? Has the Government or Children's Health Ireland sourced a surgeon at home or abroad who can do this work? And will the Government establish an independent task force with the remit that was set out last week to engage with and act on the concerns of parents advocates to improve the health service for all of these children? And please also, in your response, Minister, can you tell us why any of the children or family should trust anything you say, given that you made that promise 7 years ago and you broke it?
Minister, please.
Thanks very much, Deputy Doherty. I want to join with you firstly in acknowledging the ruling from the High Court in Belfast earlier today by Mr Justice Colton. It's a long ruling. I think it's a judgment of around 200 pages, but it does certainly seem positive, and positive from the perspective of the Irish Government wanting to work to ensure that all families get justice, because all families, of course, deserve justice. And officials from the Department of Foreign Affairs are in close contact with organisations assisting the plaintiffs in this case. There are many families in Northern Ireland who stand to be impacted by the Legacy Act, who I know will be studying today's judgment carefully, and there will be an opportunity, no doubt, to be updated on that in due course. Thank you very much for raising an extraordinarily important issue, an issue that I know everybody in this House and everybody in this country who wants to see resolved. You referenced Kylie-Anne, and you're right, nobody in this House can imagine the pain that she and her family are going through. When I was Minister for Health, I met with many families with children awaiting scoliosis procedures. I remember them. I remember their names, I remember their faces. I know somewhat what they were going through, though none of us can fully imagine it. And as a result of that, I did decide to place an unrelenting focus in 2017 on reducing the scoliosis times. And you are correct, the HSE did say to me, and did indeed put in their strategic corporate plan, that they wanted to get to a point where no child would wait longer than 4 months, and that scoliosis surgeries would be brought in line with the National Health Service in the UK. I can tell you, hand on heart, that as a result of that commitment, we saw very, very significant progress in terms of achieving that target. And you don't have to take my word for it at all, Deputy, because I'm sure you wouldn't, but you can take the word, I'm sure, of the Ombudsman for Children, because in a report published by the Ombudsman for Children, it did show that by the end of 2017, we had the number of children waiting for longer than 4 months down to 29. It also says in that report from the Ombudsman that he met with many people, including myself, and he says very clearly that in meetings with myself, the Department of Health, the Children's Hospital Group, consultants, hospital staff, management, he noted there's an absolute commitment from all involved to address this matter in the best interest of children. So people worked tirelessly, and we saw wait times very, very significantly reduce. We opened an additional theatre in Crumlin. We hired additional theatre nurses. Many more surgeries were carried out in those years than had been before, and many children got access to life-transforming surgeries. All of that is true. It's also true, and you referenced a pandemic, and again, you don't need to take my word for that. If you read newspaper articles from the 8th of September 2020 in the Irish Examiner as an example, the closure of theatres, the reduction of certain health services during the pandemic did have a real impact in progress being reversed. And as a result of that, we have seen the health service working night and day to try and build on that progress, and my successor, Minister Donnelly, being extraordinarily committed now to trying to get back to where we need to get to and get this thing back on track, because they're not numbers, you're right. They're real children that no one wants to see suffering. So it is important for parents to know this. There are extra theatres opened. There are additional theatre staff. There has been €19 million allocated. That 19 million has done real things, real tangible things. It's resulted in an additional 193 staff working in the health service. Doctors, nurses, radiographers working on spinal surgeries in Kappa, in Crumlin, in Temple Street. And as the Minister for Health told this House last week, there's another wave of capacity now due to come on stream. Another theatre due to open in Temple Street, another MRI due to open in Crumlin, and 24 additional beds, because I know from memory, again, the beds are such a core component of the delivery of these surgeries. I believe 20 of them are already open. You raised two specific questions, one in relation to the issue of a task force. And I think that is a sensible suggestion, as does the government. There will be a task force established. The task force will include all stakeholders, including patient representatives and, crucially, clinicians. That's important too. The Minister for Health did meet with a number of advocacy groups last week to discuss the terms of reference for that task force. And patient advocates were very clear about what they want the task force to do. And in collaboration with the advocacy groups, work is now progressing on addressing these terms of reference. The task force will have an independent chair, and contrary to some of the misinformation out there, it will not report to Children's Health Ireland.
Thank you, Minister. Deputy Doherty.
Minister, I asked you, what is your plan for these children? What is your plan for Kylie-Anne? And I use Kylie-Anne as an example, but we could name many other children. 5 years she's waiting. 5 years. curvature of her spine 138 degrees. If it goes 10 more degrees, it's inoperable. 5 years. Throughout this period, you've been in government, whether it's Minister for Health or whether it's your successor. Stephen Donnelly made a commitment, just like you did. You gave your commitment 7 years ago on the basis of a plan. Stephen Donnelly gave his commitment over 2 years ago. Nobody would be waiting more than 4 months by the end of that year. It still hasn't happened. Kylie-Anne and many others like her not just wait 4 months, not even 4 years. Some of them are waiting more than that. And I'm asking you again, what is the plan for these individuals? You talk about money that's been invested. The Minister himself stood where you stand and saying he's carrying out an audit because he doesn't even know if all the money that he allocated went to scoliosis treatment. That's 2 years after that he announced it, on the day that we bring forward a PNB, because there is not the attention on this issue that needs to be. And the reason I put it into the life experience of the child is we have to be children-centred here. So I'm asking you, what is your government going to do? For the last 7 years you've been in government, since you've been Minister for Health and made this commitment, and you're drastically failing these children. And it's not good enough. It is simply not good enough, Minister.
What we're going to do for Kylie-Anne, what we're going to do for children right across this country, what we're going to do for parents, what we're going to do for families is get this back on track. We saw the progress that could be made in 2017. We saw the falling wait times. We saw the extra children getting their services. We saw the Ombudsman's for Children's report welcoming some of that. We now have the extra 19 million. There are additional staff going in. We're very clear on that, 193 more staff. There's a new theatre due to open. There's new diagnostic equipment due to come on stream in Crumlin in relation to an MRI. So let's not suggest that any of us have greater concern than anyone else, because I could equally ask you what you're going to do. Because whilst you've rightly been raising this over the last while, well, hang on a second. While you've rightly, we're not planning on doing that at all, to be honest. But while you rightly, Deputy Doherty, with respect also, as Deputy Cairns reminded this House yesterday, show me your budget and I'll tell you what your priorities are. This is your alternative budget. Please direct me to the page where it references scoliosis, spinal surgeries or any additional funding. This government is absolutely determined to deliver for these children. This government is working night and day. There is a task force in place. There's engagement with the advocacy groups. David Moore, a consultant surgeon, has now been appointed to head up a paediatric spinal surgery management unit. There is no lack of compassion and there will be more delivery.
Now on behalf of the Social Democrats, Deputy Holly Cairns. Deputy Holly Cairns.
Margaret Ciancorla. Minister, we're running out of time to stop a climate crisis becoming a catastrophe. Every day, every equivocation, every cowardly U-turn makes that work so much harder. We know people in Ireland are especially worried about the impact of climate change. We only need to look at the recent flooding events in Middleton to get a glimpse of what the future holds. According to new research from the EPA today, 3/4 of people believe that extreme weather poses a risk to their communities. So much of our population live by the coast or by rivers. They see that rising sea levels and flooding poses risks to their home, their farm, their futures. That's why a large majority of people, 79%, say climate should be a high priority for government. Minister, this government claims that climate is a high priority, but what we see time and time again is that your climate rhetoric far exceeds climate action. Government MEPs voted for the nature restoration law in the EU this week, but simultaneously, we have 2 separate reports in the past week alone that confirm the government is nowhere near meeting its targets. The European Commission says Ireland will only reach 1/4 of the emissions cut that we need. And the Climate Change Advisory Council states that the government is nowhere near meeting the targets you set out for your first carbon budget. And Minister, when we inevitably miss those legally binding targets in 2030, the country faces the prospect of up to €8 billion in fines from the EU. Imagine what €8 billion could do to improve our biodiversity. Imagine what €8 billion could do to expand public transport systems across the country. Imagine what €8 billion could do to protect the future of Irish agriculture. We're so far behind where we need to be now that making up ground will be extremely difficult. But at the pace this government is moving, it will be impossible. Minister, climate action requires more than plans laid out in glossy brochures and watered down legislation. It requires actually implementing measures that are going to make a real difference, and it means doing so quickly. We can't wait until next month or next year to start this work. We need climate action yesterday. Instead, this government is knowingly setting us up for failure. Minister, we all know that doing nothing is not an option, but equally, not doing enough isn't an option either. Can you outline what changes the government will make to avoid this impending disaster and meet our climate targets?
Thank you, Deputy Cairns. Minister.
Dr. Cairns, and thank you very much for raising this important issue. And may I begin by paying tribute to my colleague, Minister of State Malcolm Noonan, for the leadership he's shown within government throughout this process. And I think that does deserve indeed to be commended. I think yesterday was a very significant day. You quite rightly acknowledged that government MEPs voted in favour of the nature restoration law. I'm sure you did note that the main opposition's MEP voted against. That's, I think, of particular importance to the Social Democrats, considering you're keeping your mind open after the election. And I'm sure this is something you'll want to discuss with Sinn Féin as to why they wish to remain climate laggards at a time when the rest of us are trying to pull together and taking decisions that are hard political decisions, particularly in an era of misinformation and disinformation about what this nature restoration law does and what it doesn't do. And I do think it was disappointing yesterday that some Irish MEPs voted against this, though very pleased that the overwhelming majority voted in favour. Now that the current text has been adopted by the Parliament without amendment, not a small task with 329 MEPs in favour, we'll now move forward to the Member State approval process. That's expected to take place currently on the 25th of March, where the Member States, including our own government, obviously on behalf of Ireland, will have a chance to formally adopt this as law. And my understanding is the compromise text is currently going through the various legal processes as well. The text, I think, does see the retention of flexibility gained in general approach, including an alignment of the marine targets with the Marine Strategy Framework Directive, and a move from absolute area targets to increasing trend-based targets for urban ecosystems. I do think there's a lot of misinformation around the nature restoration law. I think there's a lot of fear-mongering. I think there's a lot of people attempting to use it to worry the agricultural community in a way that is inappropriate, because what will now happen is each state will now have to come up with its own national plan as to how it intends to act on the nature restoration law. We will have time to do that. We will each have to develop a national restoration plan, show how we intend to implement that plan, show how we intend to monitor and report against implementation. And let's also be clear, it is going to require government providing funding mechanisms to help people transition. And that is why in the last budget we made a specific decision to set aside some of our economic surplus, some of our financial surplus, into a specific fund for climate. And I think that's going to really be required now as we begin to develop the financial schemes that are going to be needed to help people transition. I'm very proud of the record of this government when it comes to climate, because I think we have taken a number of very important decisions. We've seen a 135% increase in funding for wildlife and parklands. We've seen our new national biodiversity plan. We have seen a huge increase in the number of homes now being retrofitted, in the number of people now seeking to drive electric vehicles. But there is no denying science in relation to this, and I do think there's some worrying commentary today, and I heard the director of, or part of the director of the EPA on RT Radio this morning about the number of people who still seek to equivocate around climate. There is a climate emergency. It is real. The science is real in relation to this. What we don't need to do in this house, and you're not doing it, but we don't need to lecture to farmers and others about you must do this and you must do that. We need to help people transition. The government's put a number of measures in place already to do this. The government will put more. And yesterday's adoption of the nature restoration law was a very, very significant step for Ireland, for the bulk of our MEPs, and I believe for the European Union.
Cairns.
Minister, you either, I suppose, didn't hear my contribution or questions, or you just didn't have a defence for our own climate targets, which is what I'm asking you about. Obviously, I welcomed the government MEPs voting for the nature restoration law, but I didn't ask you about that, and that's all you kind of replied about. The reality is that independent expert groups believe that we're on course to massively miss our climate targets. So if you can accept that, if you can't accept that reality, it's quite worrying. There's no denying the science, and continuing with an incomplete and inadequate climate action plan guarantees failure. Expecting the nature restoration law to change that course is guaranteed failure. If we don't act now, it will devastate the country, and the people who will feel the impact first will be our farmers, our rural communities, and people living in poverty. Minister, can you tell me what all of the experts who say we'll miss our targets are missing if you don't agree? You didn't reference our targets, because when last year's offshore wind project in the country when the last one is 20 years old, when the government promised a low-interest loan scheme for retrofitting would be placed by 2020, but nearly 2 years later we still don't have it, when 85% of our protected habitats are in poor condition, with 46% in active decline. The list goes on. Minister, do you accept the reality that the government is not going to meet your climate targets? You don't accept the science?
Thank you, Deputy. The time is up. Thank you.
And what are you going to do about it?
Minister.
Just because someone doesn't agree with you doesn't mean they don't accept science. I'm actually a minister for science, just for the record. So I very much accept the science, and we very much accept the advisory structures we set up, and we very much accept that the challenges and targets that have been set are really difficult, and it very much accepts that every day, every week, every month it requires government doing new things. But if you take agriculture, for example, as an area that has significant focus on... No, I accept where government is... Yeah, it'd be lovely to answer it. The government is absolutely bound by the targets and is working to achieve the targets. Do I accept the targets are extraordinarily challenging? I do. But I'm pointing out that in sectors where in this House it has been said, farming, for example, will never reach its targets, that's now not true. We're actually seeing emissions from farming and agriculture drop. We're seeing farmers do their bit and make the difference. We're seeing investment in technology through Science Foundation Ireland, for example, to help farms now, indeed, I think in your own part of the world, in West Cork, become carbon neutral in terms of how they deliver. We're seeing a real increase now in the investment that we're making in the retrofitting of our homes to get 500,000 done by 2030, which is a core part of our plan. We're seeing incentives to help people convert to electric vehicles. We are making the investments, and we will make more, because I do agree with you, the climate emergency is real, the science is clear, and meeting our targets is absolutely required. And we will continue to work across parties to make that happen.
Now, on behalf of the regional group, Deputy Verona Murphy.
A disturbing article appeared in our local paper last week with regards to the South East Technological University. The article discusses a conversation that took place at the Wexford County Council meeting between the now retired Chief Executive and a local councillor, whereby it's alleged that the SET2 and the Department of Education, or the Department of Higher Education, I should say, your own department, are dragging their heels. Before the SET2 was formed, I am myself a graduate of what was or is now South East Technological University. We have a very limiting campus, one whereby we can't expand, certainly not into STEM courses, but we do have over 1,100 students in that campus. And what we look forward to very much is a new state-of-the-art campus, which you yourself have endorsed heavily. We also have the devolved Department of Environment in Wexford, the Department of Agriculture. So I would see the future of education in Wexford very much in bringing STEM courses when this new campus is brought to Wexford. And I would very much hope that what's alleged in this article is not true. I would very much hope that the families who are contacting me about whether or not their children will be able to start their third level education in a Wexford campus of SETU. They're looking for timelines, Minister. They're not looking for stories that actually will result in non-delivery. And I think that is the big issue for people. Stories are all well and good. Photo opportunities are all well and good. Headlines for councillors, chief executives, TDs and ministers are all very good. But delivery is what's key. And I think it's paramount that we understand that Wexford has been left behind up to the setting up of SET2. I can tell you I couldn't have furthered my education were it not for the campus in Wexford of the then Carlow IT. I undertook my course at night time. I couldn't have other than that. And as a result, I have a law degree. And I'm very proud of that. But there are many, many parents who envisage not being able to send their children to third level education because of the cost of living increases they're experiencing. Because of the cost and the exponential cost of accommodation that they're experiencing and what they're going to expect to pay for accommodation in cities such as Dublin, Galway, Limerick and the university cities. So it's paramount to the people of Wexford and the surrounding South East counties that we get our state-of-the-art campus and that it encompasses the STEM courses as well as utilising the departments that are devolved in Wexford. We have a huge expansion in Rosslare Europort ongoing. And I think our offshore wind development the campus and what we foresee in education will only complement that. And that's what we need to plan for, and that's what we need to see. So, Minister,
Thank you.
I'm asking you, are these allegations correct? And why are you dragging your heels?
Minister.
Thanks, Deputy Murphy. I'm hoping you ask a question that you know the answer to is that we're not dragging our heels, because the commitment that we've given to the people of Wexford, given to you, and the commitment we've given to the people of the South East is real. Is very real. It's very real because we've invested an awful lot of money in it already. So to be absolutely crystal clear, it is our intention to develop a state-of-the-art campus in Wexford. As you know, Deputy, we and specifically the South East Technological University have been working very closely with the local authority to try and secure that permanent home for the Wexford campus. Because I should just pause and make the point that you referenced in passing. There is already around 1,000 students studying third-level education through SETU. You were one of them once in County Wexford. So we already have around 1,000 students studying in a university in Wexford. They're not in a state-of-the-art campus, though. That's the problem. And there's an ability to do a hell of a lot more if we can give them those modern facilities. So we have, as you know, identified the preferred site. There's been a very lengthy negotiation process that didn't reach agreement, and Wexford County Council have since progressed the acquisition of a site totalling 48.5 acres by way of compulsory purchase order. The intention is that a proportion of this site will now be used to facilitate a new Wexford campus for SETU, with the remainder of the site being developed by the local authority, and you'll have more information than I do on that. I was delighted to announce back on the 9th of November 2023 that the acquisition of the Wexford town site has progressed significantly, and what I mean by that is they had issued the notice to treat being served. Now, the legal advice to me is that once that notice is issued, it marks a very significant milestone because it legally obligates the local authority to acquire the property, and it also legally obligates the owner to surrender same. So the SETU is now engaging with the Higher Education Authority to develop its case, what they want to develop on that site. The project will be progressed through the Technological Sector Strategic Projects Fund framework. That's how we intend to fund the development on the site. I spoke with the President of the South East Technological University, Professor Verona Campbell, as recently as yesterday. I'm very confident from that conversation that she, her team and her governing authority have a very clear vision for the site. It is a vision that reflects on the strengths of the region and builds on links with employers in the region. It's not for me to speak for the autonomous institution, but I think a number of the areas you referenced around playing to Wexford's geographic strength makes an awful lot of sense. I think the offshore wind is an obvious area of huge potential. And I'm absolutely confident that Professor Campbell at the South East Technological University and my own department not only are not dragging our heels in relation to this, are enthusiastic proponents of having a clear plan as to what can go on that site. Of course, it goes without saying, but we best say it for the record, the President of the University does have to follow the various approval processes, the Public Spending Code, and she does obviously need to seek governing authority approval. Once that happens, it will feed into that overall master plan. But I have heard a little bit of misinformation too, and let me correct that, not from you by the way, a little bit of misinformation around the SETU is holding up the master plan. That is not true. Wexford County Council should progress, as they intend to do, with their master plan. I'm absolutely confident that the work SETU are undertaking will complement that and fit perfectly within it. And my understanding is they intend to put their draft master plan out to consultation in June, with responses due back by October.
Thank you, Minister. Deputy Murphy.
You're reaffirming the endorsement of a new campus for Wexford, and I'm glad to hear that, and the people of Wexford will be very glad to hear it. I think what's not helpful is that these allegations made at a public meeting of the County Council. It also actually says that whilst the CPO process was invoked in January, that it was completed in March. And I think intelligent people will know that that's not the case, that the notice to treat was served, but that the process is anything but complete. But I do believe what people want is a timeline here. And what I'd ask you to do, Minister, is to ensure that the President engages with the County Council so as that we don't have, as I say, he is now the retired Chief Executive, actually making these allegations then that they are holding it up, because that's exactly what the article says, which is exactly what was said at the meeting. And I think it's the same for county councillors trying to make political capital. People are very concerned about this, and they want a timeline more than anything, that their children will be afforded the opportunity of a third level education. And for some, that means in Wexford and Wexford only. Thank you.
Sure.
Believer that having access to a university in your county, in your community, makes a real difference. I met the people in Wexford, a number of the students in the Wexford campus, and they told me, similar to as you said, that they couldn't have accessed third level education were it not for the provision of a campus in Wexford. We also then go on to say, how much more could we do in Wexford? What would the benefits be in terms of foreign direct investment, in terms of job creation, in terms of playing into the strengths of the South East region, in terms of complementing, and I see sitting beside you, Deputy Shannon, in terms of complementing the work that will go on in Waterford and the Waterford Crystal site too. I'm very happy to come to Wexford again. I'm very happy to meet with all the stakeholders, because we're very clear as a government, very clear, and I'm very clear that the President of the University is very clear that a state-of-the-art Wexford campus is key. It's in their strategic plan. It's in their published strategic plan that has been through the governing authority. But everybody needs to understand that the President has a process she must follow. She absolutely must follow, and is entirely correct in how she's following it. The various approval processes that you have to go through in here as well. That doesn't in any way, shape or form mean that they don't intend to slot into the master plan. They do. I'm looking forward to the master plan going out to public consultation in June, to getting the feedback in October, and looking forward to visiting Wexford and having engagement on this shortly.
Thank you, Minister. We move now to the Rural Independent Group and to Deputy Carl Nolan.
Minister, information supplied to me in a response to a parliamentary question to the Minister for Health revealed that from 2010, the total cost to the state of defending medical negligence litigation against the HSE and Department of Health, including court settlements, now exceeds €3 billion. In fact, there has been a 400% increase in costs from 2010 to 2023, rising from 74 million to just over 350 million in 2023, respectively. I'm sure that you will agree with me that these are staggering costs and a very clear indication that something is profoundly broken when a health system for such a small country can generate these kind of costs and settlements. These costs relate to claims against all HSE locations, that is, acute and community settings, Section 38 service providers and the National Services and Disability sector locations. Behind these costs, however, are traumatised patients, devastated families who are left with lifelong care needs, and indeed doctors and medical professionals who have been broken by the adversarial and lengthy nature of the litigation process. We know that doctors are leaving our system because of this. Indeed, as Professor Gabrielle Colleran, the Vice President of the Irish Hospital Consultants Association, pointed out on Monday on RTE in response to my parliamentary question, she pointed out that Ireland, along with the United States, is top of the table internationally in terms of medical negligence litigation. Some of the major reasons for this, as Professor Colleran pointed out, relate to the ongoing failure to optimise care, treatment delays, unfilled medical posts and overcrowding in A&Es, which generates their own kind of adverse outcomes, including death, unfortunately. Minister, in response to queries from journalist John Drennan on this issue, the Private Hospitals Association of Ireland also expressed concerns around Ireland's outlier status when it comes to the cost of medical negligence. The PHA said the human and financial cost of the current clinical negligence claim systems reveals a system that is not fit for purpose and has not been fit for purpose for some time now. So what are the possible solutions? According to Professor Colleran, the first thing we need to do is to be ambitious about the introduction of pre-action protocols which emphasise a less adversarial mediation process. As I understand it, when these kind of pre-action protocols were introduced in Australia, the cost of claims fell by 50% and the average cost of litigation fell by 20%. Minister, given the costs involved and the high likelihood that we are facing €500 million in costs in 2024, will you commit to establishing a high-level HSE and Department of Health working group to examine options such as those put forward by Professor Colleran around pre-action protocols?
Minister, please.
Well, thanks very much to Deputy Nolan. And if I may at the outset just say on the record of the House, I want to call out and condemn what happened to your own constituency office. And I'm thinking of you and your staff, and obviously encourage anybody who has any information to come forward to the Gardaí in office. It's an utterly despicable act, and it should be called out and condemned by all. I want to thank you very much for raising this important issue. And I think you've made a number of constructive suggestions and interventions in relation to it. I mean, the first thing we obviously need to do is make our health service as safe as it possibly can be. And obviously that requires additional capacity because obviously reducing overcrowding in EDs does indeed play a part in helping have a safe environment. But also putting structures in place where when something does go wrong, and in health things can go wrong, to make sure that all of the facts are shared with patients, that they're shared in an upfront and frank manner, and that a safe environment for the exchange of that information is provided. I know there's been a lot of work going on in health over the last number of years in terms of the establishment of the National Patient Safety Office and indeed the landmark legislation that we passed in this Oireachtas in recent years in relation to the Patient Safety Act and the provisions around open disclosure there. And certainly from my time as Minister for Health, I know in meeting with many patients, often the failure to disclose caused significant pain, very significant pain, but also caused people to feel that they were forced into the legal system, where actually often they were just wanting answers. They were wanting someone to be upfront, they were wanting someone to talk with them, and they were wanting someone to engage with them. And equally, I know from the clinician side, they would say, perhaps not equally, they would say that actually we don't know how to interact in that and there needs to be clear policies and clear laws. So I do think the Patient Safety Act, as it now is, was a really, really important step. But you are right, there are measures that need to be taken in relation to how we reduce the costs arising from medical negligence. Of course, we need to reduce medical negligence, but to Professor Collerin's point and others, there are steps. And that's why, from memory, in January of last year, the government appointed Dr. Verona Murphy, very eminent individual, the former master of one of our maternity hospitals, a leading clinician in this country, to chair a group to do exactly as you suggest, to look at how do we reduce the cost of health-related legal cases and to have a particular focus on some of the higher cost cases as examples as well. My understanding is that that work is nearing a conclusion, and of course when that happens, that report will be considered by the Minister for Health, by other relevant government colleagues, published I expect, and of course brought to Cabinet, because we do need a roadmap here. It is important that we look at how we can reduce patient safety instances in our health service in all aspects of it, as you spoke about, but it's also important that when things do go wrong, that we have a system in place that is not an outlier in any manner or means in terms of costs, in terms of legal costs, in terms of timelines to many other neighbouring jurisdictions.
For your comments of support, which are appreciated. And in response to this issue, I do feel that certainly there needs to be more accountability, and I do acknowledge that there are measures in place around patient safety. But I think if we look at the model, it's failing, and we have a situation where patients and indeed medical professionals are caught up in a system that just isn't fit for purpose. And I really do believe that the establishment of a working group between the HSE and the Department of Health would be a good approach to take. And I would hope that such a measure could be put in place, along with the other measures that are there, of course, to try and make sure that Ireland isn't an outlier, and to make sure that we can address the issues and ensure that all times, more importantly, that there is accountability within our health system. Garv Margaret.
Minister.
Nolan, and what I can assure you is that on the group that is being chaired by Dr. Mahoney, the HSE and the Department, the State Claims Agency, and I think the Department of Finance are represented on it. And I have the terms of reference here. They're going to look at how to assess the reasons why costs of claims are continuing to rise, to develop a plan to implement risk management, to recommend measures to address patient concerns, to receive updates on the implementation of recommendations that are set out in previous reviews around the law of tort as well. So fundamentally, this group needs to look at how it can make suggestions on what measures, practical measures, can be taken to help reduce costs. I am pleased that there is a wide variety of expertise from government and outside of government on that. My understanding is that that group is due to report shortly, and I think government can reflect on your suggestion at that stage in terms of what it needs to do to implement and consider those recommendations. But we're very much looking forward to it. We're very grateful to Dr. Mahoney for agreeing to chair it, for bringing very significant healthcare experience to it, and for the many other people sitting on it, and we look forward to its output.
Thank you very much, Minister. That concludes Leaders' Questions for today.